This is Kaylee Copeland with Equine Information Source, and today I am here with Dr. Emily Zakrajsek. Emily is a 2018 graduate from the Ontario Veterinary College at the University of Guelph, who currently practices in Tillsonburg, Ontario as a mixed animal practitioner. While she's happy to see animals of any species, horses are her passion, and Emily strives to use her role as a veterinarian to educate others on equine health. It's great to have you here, Emily. Thank you for chatting with us today.
No problem.
Horse owners may be more hesitant to call the vet, opting to wait a situation out instead due to financial concerns created by the COVID-19 crisis. With this in mind, how can a horse owner know when it is absolutely time to call the vet?
One thing I like for owners to be able to take an accurate heart rate. In horses, heart rate has been well associated with pain. So a heart rate over 40 in your average size horse would be concerning. Other things, kind of common sense, if their breathing is very labored, if they've got a wound that's over or suspiciously near a joint, or the tendons along the backs of the legs, those are things that can go bad really quickly, so should be seen. Anything to do with eyes, I like those to be seen right away to have the best chance at saving the eye. Certainly there's some areas where things can be managed on their own. So like a mild lameness that's lasting only a day or two, that can definitely wait. A mild cough or a little bit of a snotty nose, as long as proper sanitation is enforced there. During these times, a lot of veterinarians are likely to be open to taking phone consults, even if it's something you're not sure, is this serious enough to call, is it not? Just give them a call. Often we can talk through a few things on the phone, maybe have you send some pictures or a video.
With that in mind, what are the best preventative measures that horses owners can take to avoid injury or illness in their horses?
Just having someone pop by to even check on the horses 2 to 3, even more times a day. Horses are really good at finding things to get into, so the more often someone just does a quick check over, the better. Taking a set of vitals, such as heart rate and respiratory rate, is never a bad idea. I would probably do them maybe once a week at most. Checking pastures is a huge one. I do see a fair amount of toxicities in my area, and also those fence lines. That's the most common spot horses get hurt. Daily grooming, just for the sake that you're putting your hands all over, is excellent.
What are the most common mistakes you see horse owners make with regards to their horse's health?
Assuming old age itself is a disease. Horses can be very healthy into their late 20s up to 30s. Old doesn't necessarily mean thin and struggling to walk and unable to eat, all those things. So definitely, keeping in mind that preventative care especially is something that's lifelong for that horse, not just in their younger years. And then the other thing I would say that I do see, assuming something is the same because it looks the same as something they've seen before. There are plenty of things that look very similar, like for example, a lameness in a front leg could be an abscess, could be a torn tendon, could be a fracture, could be multiple things. And just because it looks the same doesn't necessarily mean it is.
Do you know of any resources where horse owners can learn these first aid skills if they might not be familiar with them?
I know for sure Equine Guelph offers some online and potentially practical first aid courses. I would say a fair number of veterinarians also host those types of meetings. I know usually twice a year I have like a meeting at a local brewery and just invite all of our horse owners, and then I cover a topic that's of interest to everyone. So first aid is a really great one. And honestly, the other best resource is asking someone you know. So whether it's a trainer or an experienced owner of a boarding barn or your veterinarian next time they're out.
If a barn's boarders do not intend to travel off property with their horses this year, could this help reduce the cost of a barn's treatment and herd health plans?
I would say the 3 respiratory diseases, so our strangles, our rhinopneumonitis and our influenza. Those are 3 that quite honestly are what we call risk-based vaccines. Important to remember is that you need to screen everything. So it's not just traveling for schooling or shows, but are you getting together with horses from other properties for trail rides? Is it a boarding barn? So are potentially new people coming in with new horses? That's a big one that I think gets missed. There's no direct regulations that boarding barns have to have in place. It's kind of up to the owner of the barn to decide whether they mandate vaccines or not. So, and whether they mandate a quarantine every time a new boarder comes to the barn.
What protocols are vets currently following when visiting facilities?
We're wearing masks when we're on farm. We always sanitize boots and hands between visits. I also have been asking owners to have a limited number of people in the barn just so that there's less crowding. I really just need one person to hold the horse, so that certainly, helped reduce people being in close contact. I asked not to have children running around just because of the situation, and avoiding having elderly people or people who are immunocompromised be the horse holders, just because I come into contact with so many different people.
Are there any other strategies horse owners can take to reduce their veterinary expenses?
I know it certainly makes me happy, and it makes my clients happy too, to split a call fee. If I can go to one barn and spend my whole day there doing work for multiple different clients on multiple different horses, that makes my life easier. That's also nice for continuity too, because then it's really makes a lot more sense to me when everyone at the barn is getting the same vaccines, following the same sort of protocols. That's really how you're going to get the best protection. The other way, honestly, to save money is to use preventative measures. So vaccines and teeth are the two biggest ones on my end. Obviously, having a farrier is another super important aspect. I see much lower bills overall in the clients that I see on a yearly basis to do a fecal, do their teeth, do their vaccines, versus the clients who I never see. I get called, they're an emergency. Those bills end up being a lot higher.
Well, thank you so much for chatting with us today, Emily. I really appreciate it. And I think you brought some awesome information to the table that's going to help a lot of horse owners.
Well, thank you.